Alright, this is my patient Sierra, and we're going to be doing a Snellen test chart on her to see what her vision is. So we will begin. Alright, can you read this line for me?
PECFD.
And the next one?
EDFCZF.
Okay, and this one?
FELLPZD.
And then the next one?
I can't see that one.
Okay, and cover up your right eye. And start reading the lowest one that you can read.
Okay. LPED. I think I can see the next one down. PECFD.
Okay.
And then ZD. That one's pretty blurry for me.
Okay. And now let's try the other eye.
Okay. PECFD. And I can barely read the one below that one.
Okay.
I normally wear glasses, but today I don't have them with me.
And we are going to try the nearsighted vision. You hold it about 14 inches away and have them read.
Okay. The most prominent landmark is the optic disc,
Okay, and cover your right eye.
located on the nasal side of the retina.
And then the other eye.
Distinct and sharply demarcated, although the nasal edge may be slightly fuzzy.
Her near vision is fine. Okay, so on the Snellen chart test on Sierra, both eyes were 20/25. Her right eye was 20/40, and her left eye was 20/30. She usually wears glasses, but she does not have them with her today. Alright, I'm going to be doing an eye assessment on Sierra here. Have you had any changes or concerns with your eyes in the past 6 months?
Mm-mm.
Okay, I'm going to start with her eyebrows. I'm going to look at her eyebrows. They are symmetric. There's no lesions in them or any scaling. I'm going to look at her eyes. Can you close your eyes for me? Her eyelids do, when they close, they do cover her whole eye. There's no lesions or there's no bumps. Her eyelashes are on the margin of her eyelids. They are evenly distributed. They do curve outward. I don't see any poking or curved inward into her eye. Have you had any eye irritation?
Mm-mm.
Have you had any drainage from your eyes? Okay. Alright, we are going to look at her eyeballs. They are china white. I can see some blood vessels in there, but there's nothing concerning there. I'm going to pull down her eyes a little bit. Look at her conjunctivas. Can you bring your head down a little bit for me? Both of her conjunctivas are pink. I see no white. There is no swelling, no lesions. I'm going to have her look up. I'm going to look at her sclera. Oh, I just did sclera. Okay, I'm going to look at her and palpate her lacrimal glands on both sides. Is that any pain? Can you open your eyes for me? They are pink, no pain. I'm going to palpate her orbital ring. No pain, no swelling, and there's no nodules in there. Do you have any pain when I was palpating?
Mm-mm.
Alright, we're going to be assessing my patient Sierra's pupils here. So, if you don't care to look at me, I'm going to shine a light in each eye. Okay. Alright, both pupils are round and reactive to light. They are, I'd say, about the size 4 millimeters. They both constrict equally when I shine the light in just one eye. They are symmetric. I'm going to do the accommodation test. Just follow my fingers and go away and towards you. And as my finger goes towards her, her pupils constrict to follow and to see it. I'm going to also do the 6 cardinal fields of gaze. She did those well, followed well. I'm going to do the corneal reflex. I'm going to look in her pupils with the light and see where it reflects. It reflects from both sides, or on the same spot in both eyes, which is what you want. Alright, we're going to do the cover and uncover test. I'm going to start with her left eye. There is no strabismus noted, and her pupils do not change size when I do that. Alright, I'm going to be assessing my patient here, her ears. I'm going to look at both of them. Go back her hair a little bit. Can you look this way for me? They are symmetrical. Her lobes are attached. The cartilage on her ear is thick on both sides. I'm going to look behind both ears. There is no swelling. They're not red. I'm going to look on just the inside of her ears. I don't see any earwax or any buildup. Let me check this one. No. And if we had one, I would take an otoscope. I would pull her pinna up and back, and I would look in her ear. To look at her eardrum, we would want to see a gray eardrum, and you would want it to be a little translucent. You wouldn't want it to be red. You would see if the earwax in her ear was either dry or wet. It can be either. You just want to make sure that there's not too much in there, because it can become impacted, and that can mess with their hearing. I'm going to do the whisper test on Sierra. I'm going to cover one ear, and you repeat what you hear back, okay?
3.
H.
H.
T.
T.
6.
6. L. S.
Okay. She passed the whisper test. Also, 2 other tests I would be doing is the Weber and Rhine, but we don't have a tuning fork, but I will explain those. With the Weber, you would take the tuning fork and you would hit against something and make it ding, and you would hold it to the center of her forehead, and you'd ask her if she could hear it louder in one of her ears, and if not, that is normal, and if she can hear it louder in one ear, that would mean she has some hearing problems. And then the Rhine test, you would hit the tuning fork again and make it ding, and you would hold it back here on her mastoid bone until she could no longer hear it. And then you would bring the tuning fork up against beside her ear, but not touching, to see how long she could hear it and if she could hear it better. And usually it's supposed to be heard better through air, so that's what you would want. That concludes my eye and ear assessment on Sierra here. Thank you.